Well, good morning, everybody. I'm Brooks Keel, the president of Augusta University, and as you will see in a few minutes, we have Provost Gretchen Kaufman and Mickey Williford, our director of our institutional effectiveness program here, and we want to give you some oversights and opportunities, some updates on where we are and what we've been doing at Augusta University and the AU Health System over the past several weeks. We try to have these town halls as frequently as possible as new information comes in, and we want to share with you. And that's the purpose of bringing you all together here today. So thank you very much for tuning in with us. I want to have you, if you would please, go ahead and start the slides. I want to show some slides here that hopefully will help guide my part of the conversation. And there are a couple of main things we want to talk about. And obviously we want to talk about what impact the coronavirus, the novel coronavirus, COVID-19 has had on Augusta University and continues to have on Augusta University. But we really want to focus now on what impact is this going to have on us in the future as we move ahead. There we go. Okay. I want to start with this, and many of you who have seen me give presentations, you see I always like to present this, and I think it helps ground us and what we do. And at Augusta University, we have only one priority, and that priority is our patients and our students. And everything we do at Augusta University and the Augusta University Health System revolves around some aspect of providing outstanding patient care and state-of-the-art training and education for our students. And even in the midst of COVID-19, that priority remains. And I'm incredibly proud of all that our university has done to address that one singular priority for us as a university. And I'm going to take just a few minutes and talk about what we have been calling our AU heroes. And we've got so many heroes that are associated with Augusta University, being the state's only public academic medical center, the state's only public medical school, and being the academic medical center for this part of Georgia. We have a number of heroes that are working day in and day out to try to address that priority, our patients and our students. And if we talk first about our patients before we move on to some of the great things we're doing on the academic side of the house, just lost our slides. Whoops, sorry, back up one here. Okay, but let's talk about patients. We've been promoting our AU heroes at our academic medical center here, and I just want to take just a quick minute to show just a snapshot of all the great healthcare providers we have at AU Health System. These men and women are putting themselves on the line there at the very epicenter of addressing the COVID-19 crisis. And we are just so incredibly grateful for all the wonderful work that they do. This is what you expect out of the state's only public academic medical center. And they have been doing outstanding work day in and day out to address this issue and to make sure that our patients, whether they have COVID-19 or not, are receiving the most outstanding health care that they possibly can. And at the same time, providing the education for our students, our residents, and our fellows, because that is what we do at Augusta University. But I want to talk a little bit today more about our students, the other priority that we have. And let me just say that we have so many of our AU heroes, our faculty that have in an incredibly short period of time converted what is a more classical in-person on-campus institution that we know and love, and in 2 weeks' time converted all of that into a online educational opportunity for our students. The work has been nothing short of Herculean, and it is clearly heroic. And I just want to give a shout out to all of our faculty who have had to convert their in-person classes to online to make sure that we continue to provide our students with the best education possible. Let's see here. Losing our slides a little bit. There we go. Now I want to talk about two main topics here today. First, I'm going to spend a few minutes talking about the non-closure emergency leave, and we are extending that opportunity for our employees. And then we're going to turn things over to the provost and to Mickey Williford to talk about our plans to reopen this campus in the fall. So stay tuned. We want to give you some insight into how we're planning to do just that. Let's go back to my slides here if we can. There we go. All right. First, we have extended our non-closure emergency leave until the end of June. Now let me point out the next few slides apply to Augusta University only and do not apply to the AU health system. As you know, we have the state of Georgia and the University System of Georgia have allowed us to offer non-closure emergency leave for those employees that, due to the nature of their work, they just simply can't telework from home. It allows us to make sure that these employees are continue to receive their pay and continue to be our employees throughout this time. We are extending this emergency leave until June 30. We're losing the slides here. There we go. And in response to the governor's recent guidance, we want to make sure we all understand that the following guidelines will be in place through the end of May. First, AU will continue with essential employees. These are employees that have to be on campus and who are required to report to campus. They will continue to perform their duties, and we will make sure that they are supporting social distancing and that we will allow telework for these essential employees whenever we can. AU will stay the course with using teleworking and flexible scheduling as the primary option for other parts of our workforce to continue operations, and we will continue to stay this course, continue to do this until we are told otherwise by the governor, the state of Georgia, and our University System of Georgia as well. Now, both of these things that I just mentioned are designed to support the governor's recent orders that employees are to continue to adhere to minimum basic operations. And that includes separating workspaces by at least 6 feet, that's social distancing, teleworking where at all possible, and implementing staggering shifts for those essential employees. Let me emphasize, now is not the time to rush any sort of return of our faculty and staff to campus, but rather we are to maintain caution and continue our focus on balancing the safety and the well-being of our employees with the requirements associated with our 2 priorities, as I just mentioned, our patients and our students. So with this in mind, AU will continue to offer non-closure emergency leave for those university employees where it is necessary. And I must tell you, I've been very, very proud and very pleased that all of our supervisors and directors have been utilizing this leave and utilizing it appropriately, utilizing it sparingly, but making sure that our employees are made whole. AU will also support some new leave options that have come out under the Families First Coronavirus Response Act. And I know that our Human Resources group and our Department of Human Resources will be working with you as we move ahead with this to be sure that you understand what these leave options are. We are allowing VPs and deans to consider, and I want to emphasize consider, having some employees who might have been designated for non-closure emergency leave or who are teleworking to return to work on site when the department can support the social distancing of 6-foot workspace requirements and other protective measures. So again, we're allowing supervisors, directors, and VPs and deans to consider allowing these employees to come back to campus as long as they can maintain the social distancing requirements. This may allow some research to resume, and we know that it has to do with essential research. It may also allow departments who have provided administrative staff to take non-closure emergency leave to return safely and handle work that could no longer be delayed. And I want to emphasize the words that are underlined here. I expect the departments to use this option wisely. Again, now is not the time for faculty and staff to rush back to campus. We're also allowing VPs and deans to continue with other modifications that they may have to support the continuation of operations, of balancing the protection of faculty and staff, and by that I mean services by appointment only. I just lost the slides again there. There we go. Services by appointment only so that social distancing can be more effectively managed, or shifts to online meetings, do virtual meetings. We want to obviously continue to do that as we are right now, and those sorts of things, again, to make sure that we maintain our social distancing. Now, the bottom line is, for now, let's stay the course. For essential employees that are required to be on campus, they are certainly allowed to continue to do so. Please maintain social distancing at all times. For those that are not essential and can telework, or those essential employees that can telework, please continue to do this. And for those staff that just simply, the nature of their job does not allow them to telework, you are now able to use the non-closure emergency leave to protect those employees, and we encourage you to do so. I'm sure you have questions, and if you do, I encourage you to ask our Human Resources Department. They are the experts. They can help you with non-closure emergency leave. They can help you with flexible shifting that we may need to do. They can help you with leave if any of our employees are sick. And please, if you are sick, do not come to work. Contact your healthcare provider, stay at home, and contact your supervisor so we can make sure you have the appropriate leave to do so. Now, I'm sure everyone wants to know, okay, that's good for today. What's going to happen tomorrow? What's going to happen the next day? What about this summer? And more importantly, perhaps, what about the fall? And if I had a crystal ball, I could tell you exactly what's going to happen. Unfortunately, I don't have a crystal ball. And there are a lot of questions that we have about what's going to happen in our next fiscal year and what's going to happen on our campuses in August when we open things back up, and that is the goal. And let me give you just a little bit of insight into some of the questions that I know you have. The first thing I want to point you to is that huge question mark that's over on the right-hand side. And these are questions that we just don't have answers to at this point. What about the fiscal 21 state budget? We just don't know what that's going to look like at this point in time. We have heard that the General Assembly will go back into session. It will probably be sometime in June. We're hearing that is probably the date, but they have not set a date yet. When they do come back into session, they will pass the budget. They are constitutionally required to pass a budget for fiscal year 21, and we will know what that budget looks like when they pass that budget. So please stay tuned. We're getting constant information and guidance from the University System of Georgia, and we greatly appreciate their support on this. And as soon as we know what the state budget might look like, we will let you know and help and have you work with us to work this out. Will there be budget cuts? Again, we just simply don't know, but I think we need to be prepared for that scenario. We all know that the revenues in the state of Georgia have been dramatically cut because of all the issues associated with dealing with the COVID-19 virus. We know this. We know it's going to have an impact on the state, and we will clearly work with our system office and with our state legislature and the governor's office to determine if we need to make budget cuts, what those will be, and we will implement those accordingly. Are we able to fill new positions? As you well know, we have had a critical hire process that has been in place long before the COVID crisis really came to the forefront. And we are continuing to evaluate hiring of new positions very, very critically. We want to be as conservative as we possibly can to ensure that if we are faced with budget cuts, we're in a much better position to do this. So our supervisors, our directors, our deans, and VPs, and especially the executive vice presidents have been super critical on hiring new positions, and we want them to continue to do so as we prepare for what the fiscal year 21 budget will look like. And I get asked a lot, will there be furloughs? There's a lot of talk, a lot of rumors about furloughs, and let me tell you, that at this point in time, they are just that. That is talk, and it is rumors. The simple answer is we just don't know. And we won't know what that will look like until we understand what the state budget's going to be. Now, I know this is frustrating, and I know it's unsettling. And I know that we would like very much to be able to get back to some sense of normal, and we will. But I'm just asking every one of you to please be patient. Be patient with us as we work through this situation. Be patient with your state, and be patient with our system offices. They also work to try to determine what our future is going to look like. We're all in this together, and we'll all get through this together. And again, I ask you to please be patient. We just don't have answers to these questions, but please know as soon as we do, we will get those answers to you as quickly as we possibly can. All right, folks, let's get back to school. What's the fall 2020 going to look like? And that's where I want to spend the bulk of this conversation moving forward. And there are a number of ground rules that we're going to have to follow as we get prepared for the fall semester of 2020. First, as a system and as a university, we plan to be open in the fall of 2020. We plan for the semester to be open and for us to have students on campus. Now, that is our plan as of April 30th, 2020. This is an incredibly dynamic and fluid situation. You have heard us say that over and over again, and I know that you know this. So please, again, be patient, although the plan right now is for us to be open in the fall. And we're going to be planning to do just that, as you'll see in a minute. We have to be very, very flexible, realizing that this is a dynamic and fluid situation. The plans that we prepare for today are going to change. I don't think there's any question about that. And we're going to have to be flexible as we move ahead. So that's the goal, folks. We want to get the students back on campus in August, realizing that that's going to look very different than it did last fall, and realizing it's going to look very different than the situation does today. So we must plan for contingencies. We must plan for what happens if we have to put some or most or all of our courses online in the fall. What happens if we still have to maintain social distancing in the fall? How do we bring students back to campus in a safe way? And that is going to be our priority. So we've got to plan for contingencies. We've got to try to look in that crystal ball and predict what fall 2020 is going to look like based on where we are right now. And we have to move forward in this way. We're implementing a project that is designed to do just that. With using the guidance provided by the University System of Georgia, the provost, Gretchen Kaufman, and her folks are leading the charge in putting together a plan to address these contingencies and try to help us determine what it will look like in 2020. This plan will be submitted to the University System of Georgia, and they will approve our plans and will approve the plans of all the 26 campuses across the state, and they will help guide us as we move ahead. So I'm going to turn things over now in just a moment, to Dr. Kaufman. She's at Working Right Hall, and she will give us some ideas about where we're going to be moving forward. I will just ask everyone to continue to stay calm and continue to wash your hands. And at this point, I'll turn things over to Dr. Kaufman.
Thank you, President Keel. Thank you so much. And if I could just echo your thanks and gratitude, appreciation, there really aren't words enough to say how incredibly thankful I am that I am part of this institution. The health system and all of its healthcare workers are doing such an awesome job. And also, so are each and every one of our faculty and staff who we have not closed. We're going to talk about campuses reopening, but we all understand the university never closed. We have been going full bore, and that's because of each and every one of you. So thank you so much for that. We are looking toward the future, however, and whatever that new normal is for us. And I'm very happy to be able to report on the beginnings of what will be a great deal of work by a lot of people in this campus reopening project. So with that in mind, we'll go first to the scope and talk about how that is going to be panned out. Through the creation and utilization of work groups that we'll be talking about in just a minute a lot more, this project is going to define and document a comprehensive plan to reopen all of the campuses of our university fall 2020. With all of the caveats that President Keel just mentioned, though, we don't know what our world will look like necessarily come August, so we're going to remain flexible and we're going to make sure that we have contingencies. But we do have to plan, and we will execute on what is the very best plan possible at that time. In terms of that, then, those are some of the deliverables to define, develop, and execute the plan. We want to have a plan for communicating with students, faculty, and staff, and also all of our community members. People are very invested in this university, and we want them to know. And communication is something so key for all of us. It's also important as we go through this process, absolutely unique as it is, that we document the actions, the decisions, the communications, and we want to learn from this. We surely hope we'll never have this particular circumstance again, but there will be other critical events, and we can all learn from them how we move forward. Next slide. Okay, so just a bit about this, not to get too deep in the weeds of the project management, but I think it's important to understand the framework, because a complex undertaking like this is better affected if it has strong framework on which it's built. So certainly, as our project sponsor, that is our president, Dr. Brooks Keel, as he mentioned, I and Dr. Russell King are the project leads, so we're really trying to take the helm, so to speak, in terms of the overarching guidance for this. We rely, though, very, very heavily, of course, on our core team, which is the president's executive cabinet members, as well as the work group leads. And this is where the rubber meets the road, is in the work groups, and those leaders are so key. And our Vice President for Institutional Effectiveness will be talking about that very shortly in terms of what that means. The little peg people at the bottom don't nearly multiply to enough, actually, of those involved. They're meant, though, to depict that. We do have 9 work groups and for specific areas, focus areas, that each of which are very vital. And it's really important, I think, to note that they span all across units, all sorts of individuals involved in this. It includes faculty representatives of the Senate, staff council representatives are in some of the groups, and all told is over 100 people are going to be involved in this. So truly representative, and they want to hear what is really important to all of us. Now I want to turn it over to our Vice President for Institutional Effectiveness, Mickey, who will talk a little bit more about the specifics.
Excuse me, and I'm sorry I just coughed into my hand. I knew better.
And we are socially distanced. Just want to point that out to folks.
6 feet. We do want to share with you what the specific work groups are. Each of these work groups actually represent one of those plans that Dr. Kaufman described in the deliverables. You'll see that the first group that spans across the slide, workplace and health safety, that is probably the most complex and also the most urgent plan that we're asked to submit to the University System of Georgia, which you'll see in our timeline on the next slide. That team is going to be led by our Vice President for Facilities and our Vice President for Human Resources, respectively Ron Booth and Susan Norton. Other teams include academics, which is led by Vice Provost Zach Kelleher, research, which is led by our Senior Vice President for Research, Michael Diamond, enrollment, which is led by our Vice President for Enrollment and Student Affairs, Susan Davies. The Student Life team is going to be led by the Associate Vice President for Student Affairs, Patrice Jackson. Public Service and Outreach will be led by our Executive Vice President for Strategic Partnerships and Economic Development, Michael Schaffer. And the Communications team is led by the Vice President for Communications and Marketing, Jack Evans. Athletics, you know this guy, Coach Clint Bryan, our Director of Athletics, will lead that team. The Finance team will be led by our Executive Vice President for Finance and Chief Business Officer, Yvonne Turner. As Dr. Kaufman shared, collectively, we've got about 100 individuals serving on all of these teams, representing diversity of perspectives and subject matter experts, as well as we want to thank Dr. Robert Scott and Don Gant as our shared governance leaders who quickly mobilized to appoint and request volunteers to represent faculty and staff from all of these teams. These teams are, in some ways, are still developing and may continue to develop. But we've kicked off this week and we're excited to get to work. And the reason we're excited to get to work and eager to get to work is because we have a very aggressive timeline at the front. As Dr. Kaufman shared, we're expected to submit our plans for USG approval, for the Chancellor's approval by mid-May. So the workplace and health safety draft will be due to Dr. Keel May 7th in anticipation of the submission to the Chancellor on May 15th. All other plans will be submitted in draft form to Dr. Keel for approval on May 14th in anticipation of an ultimate submission to the USG on May 25th. What we want to be clear about, though, is that is not the beginning of that is not the end of the project. If anything, it's a start. At that point, we're only submitting our plans, and then the real work comes to hand when we begin to operationalize those plans over the next few months. Dr. Kaufman?
Thank you, Mickey. So as you can see, there's a lot of work coming up in the next few weeks. And again, I just want to thank so much every individual that was tapped for this. And you've already displayed great commitment to it. We're going full bore, and we'll get lots and lots accomplished in the next few weeks. It is only the beginning, as Mickey said, though, and so certainly executing on these plans, or whatever they actually iterate to in the coming weeks and months, is going to take every one of us. And so I'm so confident that we can do this together. We do plan to continue to communicate with you. There'll be more information coming on our website. We'll direct folks to that as information is put up. You'll be hearing more, of course, as we go along, and then trying to keep everybody as informed and engaged as possible, because we know how important all this is to all of us. If you could go to the next slide. Wanted to switch gears just a minute. It is about the fall semester. And so as other things are different next fall, we know it's going to be a unique semester in many ways. We did realize that we had some decisions to make once the Augusta National Golf decided to do the Masters tournament in November. So it'll be a different situation for the whole city and CSRA come November. With that in mind, we wanted to see whether it was possible to do the same thing during the November Masters Week that we have perennially done for spring break for our campus, our university, during the April Masters, the traditional timing. It's not an easy thing to do. It's not a simple or a trivial thing to just shift and find the days that are needed to actually accomplish what has to be, what we are regulated to do in the terms of number of class days and class sessions. So our academic calendar committee, I asked them to look into it, to come up with some options, some things that we could consider at least, and then ultimately go to the University System of Georgia after the president approved a particular proposal, because we needed to get permission to do that. We have done that now. And so what we are showing today in this graphic really is how we accomplish that, so that we will in fact have a fall break, a full week-long fall break in November. And it will coincide with the Masters tournament, as we know it to be now scheduled. To do that, again, it comes at a cost, or it comes, it has to be a net zero. Well, let's put it that way. So what we'll do in order to accomplish that, we have moved the start date of the fall semester 2 days earlier. So rather than it starting with the first class date on Wednesday, August 12th, that will be on Monday. So we gain 2 days there. We have typically had a 2-day fall pause for students in October as a sort of mini fall break, let's say. We will take those days and move them into that new Masters Week or fall break week. So we gain 2 more days there. We then typically have Wednesday through Friday for Thanksgiving as class holidays, student holidays. We will take the Wednesday before that, Thanksgiving Thursday, and that will give us then the 5th day. So that's how we are going to accomplish it. We will be able then to continue to have the same date for commencement. So all other things about the ending of the semester will remain the same, and all of this is important. We recognize that even something as seemingly minor as shifting 2 days at the front end, coming back earlier, has a lot of ripple effects. We don't have all of the details about all of those things, about when freshman convocation will be hosted, for instance, and certain other things that will have to be taken into consideration. The academic year faculty are back already. They come a full week before that. We do not anticipate that will be impacted at all. But a lot of other things we'll have to make sure that we are thinking about. Student move-in day, and all of those kind of things that we'll have to sort out. But we can do it, and we'll do it together. So with that in mind, again, just want to mention that we're talking about fall and what that will look like, and it will be new and different, but I feel sure it's going to be successful. I want to draw your attention back to the fact that I said earlier, we're not closed. In fact, we're winding up spring semester in absolutely wonderful fashion, and we are going full bore into summer. We are open in terms of courses. We will be fully online in the summer, but we are still here, and we've got lots of great courses. And it may be an opportunity for students, all of those who are out here, to consider taking a course you might not have otherwise. Wherever you are, we're there with you at a distance, but we are together. So if you will do that, we've got faculty who have been so dedicated to converting now not only their spring courses in an instant to fully online, but now our courses that we would deliver in the summer as well. So just something to consider. Once again, I appreciate everybody and all you're doing. I miss being together with you, but even though we are at a distance, we are still together. Thank you, President Keel. Back to you.
Thank you, Provost Coffin and Vice President Wilford. Appreciate that very much. And let me make just a couple of closing comments here. First, I think anybody who lives in Augusta certainly realizes that the Masters tournament is so much more than just a golf tournament. It is the part of the fiber of what makes our community and is also a huge part of the economic growth and development of our community. In keeping with the public schools in Richmond, Columbia County and some of the surrounding areas who have also made, as I understand it, made decisions to change their schedule to allow for a break during that time. We thought it was the right thing to do to also accomplish a break during that time, because so many of our students and our faculty either are working at the Augusta National or leaving town themselves to make their houses available. You got to live in Augusta to understand the uniqueness of this, and we're delighted that we were able to change our calendar to support this event, and at the same time make sure that our students get the education that and opportunities that they certainly deserve here. So I appreciate that very much. With regards to the planning that you have seen presented to you to get us back open in the fall, again, I want to tip my hat to Provost Kaufman and Vice President Williford. This is a tremendous amount of work that we have to do in a very short period of time in the face of so much unknowns. But this is what we do at Augusta University. We are certainly accustomed to change, and this won't be anything any different. I want to thank our faculty and our faculty senate, ably led by Dr. Scotty Scott, who on a moment's notice have essentially dropped everything and to help us have proper representation on these work groups as you see it. We appreciate that to make sure we have our faculty input who are obviously play such a critical role in any university, certainly in ours too. So, and as the provost pointed out, we have never been closed, and we are open for business. But I got to tell you, this is not business as usual. We know this, and I'm incredibly proud of how all of our AU heroes, administration, faculty, staff, students, both at the university, Augusta University itself on the academic side, but also Augusta University Health System, and what they have done in the face of this crisis. So thank all of you for what you do day in and day out. Please stay tuned, stay in touch, stay engaged. And I speak to our students especially to stay engaged. You mean a great deal to us. We're not going to be able to shake your hand at commencement this May like we normally do. We are going to do that virtually at the end of the month, and we hope that you'll participate in that. And we're looking forward to, in the best way we know how, to congratulate you on your accomplishments, especially in the face of this crisis. So thank everyone very much. We hope to have another town hall in the not too distant future as we get more into the planning process for going into the fall. We'll do our best to keep you informed. Stay tuned and go Jags!